So today we're going to be talking about the national opioid crisis. What is the national opioid crisis? The national opioid crisis is essentially defined as the drastic increase in misuse of opioids and the related overdoses with those. The crisis is also labeled as the rise of newborns being born with opioid withdrawal syndrome. That's just pitiful if you ask me, and this is due to the misuse during pregnancy. The misuse and addiction to opioids includes prescription pain medicine, synthetic opiates such as fentanyl. That seems to be the worst one going around in the United States right now, and also heroin. This affects public health, social, and economic welfare. Some of the statistics that I found talking about the opiate crisis is roughly 21 to 29% of the patients that are prescribed opiates misuse those. Between 8 and 12 develop opioid use disorder, and that is pretty much just a big term for addiction. And an estimated 4 to 6% of the people that start using opiates in a prescription form turn to heroin in the long run. About 80% of the people who use, like I just said, about 80% of the people that use heroin started with prescriptions. Despite the guidelines to limit opioids as a first approach, there's about 45% of primary care clinicians who still prescribe opioids in the United States. In 2018, it showed that about 128 to 130 plus. I found two different sites that said two different things, but one said 128, one said 130 plus people overdose on opioids every single day. And then it says more than 1 million people misuse prescription opioids in 2017, and this is continuously on the rise. Well, we see this every day getting worse. This is just some continued statistics from the research I've done. From 2019 to from 1999 to 2017, almost 218,000 people in the United States have died from overdose by using opiates. The CDC estimates that a total economic burden of the prescription misuse in the United States is $78.5 billion. Yes, $1 billion a year. That's the cost of health care. That's the lost productivity, addiction treatment, and criminal justice involvement. So, I mean, it's not just one thing. It's a combination of everything. This little picture here, this is all in my PowerPoint. You'll see that when I get that to you. But this is where it says 130 plus people die every day related to opioid use and overdose. 47,600 people died in 2018. Sorry, my phone tried to die on me. 47,600 people died from misuse using an overdose. 81,000 people of those used heroin for the first time in 2018. 32,656 people overdosed on synthetic opiates such as fentanyl. My place of work, we've seen that on a very high increase rate lately. Where I'm working, they said that the EMS is coming in and telling us that the people are thinking that they're getting heroin and they're actually being sold fentanyl. And it's a very big mess, and it's very sad right now. 10.3 million people in 2018 misused their prescription opiates. Moving on, prescribers. The overall national opioid prescribing rate declined actually from 2012 to 2018. They are being, held at higher standards with those and being cracked down on a little bit in that. And it's fallen to the lowest in the 13 years, 51.4 prescriptions per 100 persons is the research that I found. However, in 2018, prescribing rates continue to remain very high, higher than we would like them to remain, even though it's still the lowest that it's been. 11% of U.S. counties have enough opioid prescriptions were dispensed for every person in the county to have one. So personally, that's way too many. While the overall opioid prescribing rate in 2018 was 51.4 prescriptions per 100 people, some county rates that were 6 times higher than that. So it just depends on the county you're in. It depends on how many prescribers you have in the county, how many people you have in the county, things such as that. It also, damages and burdens America and the United States with the finance aspect of it. The CDC said that it was an economic burden. It cost $78.5 billion a year. And like I said, the lost productivity, healthcare cost, criminal justice cost, addictions and treatment, things such as that. The mortality rate. Mortality cost us $253.3 billion. That was from 2015 to 2018. Healthcare cost $204.6 billion from 2015 to 2018. Like I said, posted in my slideshow and everything. Signs and symptoms of abuse. This is easy. This should be education that the nurse and the doctor and the physician that's prescribing the medication should give every time it is prescribed. They should sit down. I believe, and I said this even in my paper, I believe that when someone is prescribing and the nurse that follows, in the education portion before discharge, it is very important that we as nurses sit down, talk to the patient about any history of depression, any history of anxiety, any, the stressors in their life. Tell them what can happen. Tell them, look, this is the process. If you need to talk to somebody, we are here to talk to you. If you feel like you need help, we're here. Some of the signs and symptoms of opioid abuse, you'll notice that they change moods quickly. They surround themselves with different groups of people. They start isolating themselves and avoiding family. A lot of times people know that family know something's up before anybody else does. So it's obvious to them, so they try to get them away from them. They eat either way more or way less. This is dependent on the person. Their hygiene it declines rapidly. They don't bathe. They don't change their clothes. They don't brush their teeth. Depending on the medication, they may be nervous or cranky. They sleep odd hours. If they're sleeping all day during the day, going out during the night, maybe something is up. Being overly energetic, experiencing financial hardships. If they're paying for all their opioids and not paying their bills, losing interest in activities. That was in the LA, in a normal, everyday person. This is in a healthcare worker. So signs and symptoms in a healthcare worker is recurring absence or tardiness. Problems with functionality. If they're taking their pain pills before they go to work, it makes your functionality decline. Difficulty executing clinical decisions. It changes your clinical decision making. It changes any decision making, but especially clinically. If they're making a lot of documentation errors and changing their productivity levels. Disappearing for hours during the day. That's a big one there. Appearing impaired or disheveled. This one is probably the most common. This is the one people see the most. And increased administration of pain medication to their patients. That's also a big one. Ways we combat the crisis. Like I said, where I work, we've recently seen an increase in patients that think they're getting heroin and they're getting fentanyl. So it's important to educate people. And sometimes it's too late. Since I've started working there, I haven't worked there very long, but I've seen very, very few prescriptions being written for pain pills at home. I've seen them given in. I've seen, morphine, and I've seen things such as that given in the ER, but they never ever send them home with opiates. And I think that's very important. It's very important for the doctors to lean on alternatives such as NSAIDs, steroids, a combination of both. And I've seen that a lot, actually. I've seen a lot, somebody comes in with knee pain, they get prescribed a steroid and maybe some Toradol or something like that. So that's helped a lot. How can I make a difference? So also in my facility, we have what's called a navigator. It's a recovery navigator is what their title is, and what we do is when we get someone that's in for addiction, whether that's alcohol addiction or that's opioid addiction, we call them. That's whether they really want us to or not. That's part of the process. We call our navigators, and they come talk to them, kind of get down to a deeper level, figure out what's going on with them, and they can help actually place them places like what we have is called Pathways. Pathways is helps them recover. It's a slow rehabilitation stage that helps them recover, that we can send them to Lakeside in Memphis. Multiple options. The Pathways, the Recovery Navigator's job is to find a place in a facility that's best fit for the person. They come in and talk to them, tell them this is what this facility offers, this is what this facility offers, and this is what we can do for you if you would be willing. Like I said, another way that we can help as nurses and the way I can make a difference is education. It's important to tell the patients, this is what you need to be looking for. This is the signs of addiction. This is, when you need the pain medicine, it's a different story than when you don't need the pain medicine and you still continue to take it. When you have these feelings, you need to tell somebody, call us back. We're here for you. Signs and symptoms. Don't take the pain medicine if you have other medicines. People don't understand that stacking medicines can be dangerous, and a lot of times don't take multiples. If you continue to hurt, don't take 2 or 3 in a row. People that don't have a medical background don't understand, so unless they're educated properly, that if I'm hurting at 2 o'clock, I can't take, and then I'm hurting again at 3:30, I can't take another round of whatever pain medication that I've been prescribed. These are only to take every so often. So I think it's important as healthcare workers for us to educate our patients. That's all for today, and thank you for watching.